Preceptor skills. The learning objectives for this section of the presentation are to recognise and discuss what skills are required to be a good preceptor, to identify the key points to giving feedback, and to learn how to give positive and constructive feedback. Before we start on the presentation, I thought we'd cover some background. Clinical placements provide opportunities in the professional setting for the education and training of healthcare workers. Placements are essential for students to help them integrate theory into practice, familiarise the student with the practice environment, and also help build knowledge, skills and attributes essential for professional practice. The workplace allows the student to learn how to be a professional as their behaviour is strongly influenced by what they observe. But for placements to occur, preceptors are essential. Research has shown that hardly any preceptors ever receive any training or get taught how to be a teacher. It's always been assumed in the past that if you're an expert in the area or field, that you'll automatically be able to teach it. Unfortunately, in reality, it has been shown that it's not always true. Recent studies, and in particular a study published in 2008 by the American Journal of Pharmaceutical Education, pharmacy students and preceptors were asked to assess certain aspects of their teaching, and in particular giving feedback, giving positive feedback, and asking the student for feedback. It was shown that the pharmacists grossly overestimated their quality of teaching, especially in the provision of giving feedback. Being a preceptor is not an easy job. It's been shown that the clinical teaching environment is one of the most difficult environments to take on a student, as you need to ensure that you are dealing with the needs of your patient, as it is your job, and also cater for the needs of your student. The pharmacist cannot provide good health care to patients without knowing what their needs are. Likewise, the preceptor cannot provide good clinical teaching without knowing what the student or junior staff's learning needs are. Before I can explain what traits make up a good preceptor, I thought we'd look into what makes up a poor preceptor, or a preceptor that requires improvement. The lack of time is the most common issue. However, this applies to everyone, as we're all pushed for time and we need to complete our work for the day. The next point is the lack of knowledge on how to be a preceptor. We all know how to do our work, but we don't necessarily know how to be a preceptor, or what's required to be a good preceptor. The lack of training. As mentioned previously, very few people ever receive any training at all. The lack of rewards and recognition for what we do, and sometimes it's the lack of respite between students. We all get tired and have days where we just can't cope with the idea of having a student, but as professionals we have to rise above it and deal with the situation in the most appropriate and professional manner. The lack of confidence in our teaching method, as in the past many people were taught by humiliation, where a teacher or preceptor would humiliate the student in front of peers or patients. This style of teaching was very typical for the time. However, the culture in the clinical setting has changed significantly, and consultants are no longer teaching by humiliation. This cultural shift is occurring in the teaching of medicine, nursing and pharmacy. And the final point, students perceive very quickly as to whether or not you want them. Remember that over 80% of communication is via body language, so if you're having a bad day and don't want a student, you're the professional and you need to be able to rise above it and deal with the situation as it comes. So now we know what makes a poor preceptor, we'll go over what makes a good preceptor. The number one point is being a good role model. Remembering students come on placements to learn on how to be a professional. Teaching in the clinical setting has been named the sitting next to Nellie model. This model is based on students observing your behaviour. In a study completed by Atkinson et al. In 1990, it has been shown that the most common way that learning occurs is by role modelling, and that the quality of learning depends on the quality of the role model. So our behaviour as professionals is strongly influenced by our colleagues' behaviour. The same applies with students. They learn how to speak to patients, talk to other staff, deal with issues by observing us. This reinforces the importance of maintaining a high professional standard in the clinical area at all times. The second point is that you need to be available and approachable. Third point, to provide support. Next one is to be dynamic. Now, we're not asking you to do a song and dance for the students, but show them some enthusiasm in the work that you do. Studies have shown that a dynamic teacher motivates students to learn and encourages them to continue with self-directed learning. The next point is that you need to be able to deal with errors with a no-blame approach. You are the preceptor and you are responsible for the student. The student is there to learn, so you have to anticipate that errors will occur and that you'll have to deal with them within a professional manner, a no-blame approach, and minimise the effects of the error. From there, you can then help the student reflect and identify learning needs to learn from their mistake. Making time to get to know the student is also another point. It has been shown that if you can maintain a friendship with your student, you're going to foster learning. You need to be fair and friendly, but you can't be their friend and go out with them to the pub on a Friday night to get drunk together. You need to be their supervisor, not their friend. It's just basic emotional intelligence. And this brings us to the final point. Being a supervisor, you need to give the student direction and feedback. As mentioned earlier in the presentation, it has been shown that preceptors fall back on giving feedback. In the 2008 study published by the American Journal of Pharmaceutical Education showed that 93.1% of pharmacists said they gave their student feedback, while only 42.1% of students said they received any feedback at all. And in regards to positive feedback, 82.2% of pharmacists said they gave their student positive feedback, while only 35.5% of students said they received positive feedback. In general, this study shows that we seem to overestimate our ability, especially in the provision of giving feedback. All students want to grow and improve their skills regardless of their ability, and good students also want and require feedback, not just the poorly performing student. So it's important to mention both what they're doing well at and what they can also improve on. From what's been mentioned thus far, it should be obvious that giving feedback to students is essential on being a good preceptor. Feedback has been mentioned numerous times during the presentation as being an important preceptor behaviour. So now we're going to discuss what makes good feedback. It's really important to give feedback on a regular basis. Behavioural psychologist Spur Skinner developed the theory of operant conditioning. In his experiment, he trained a mouse to go through a maze and rewarded it with a piece of food at the end. His argument was that learning can be maximised through positive reinforcement and with a reward. I'm not suggesting you bribe your student with chocolates, but something as simple as a praise for their good work may help. However, it needs to be done immediately and consistently to be effective, so basic positive reinforcements could be as simple as a smile, a nod, or verbal encouragement, and maybe down the track, a chocolate. You also need to set clear goals so your student knows what is required of them and how they'll be evaluated. For example, I could say to a student, "Could you please go out and counsel this patient on this antibiotic? I would like you to mention X, Y, and Z, and I'll be standing close by to listen on the conversation." Direct supervision is also required. You can't send a student out to do a job for you and be able to make a fair evaluation of their performance if you weren't there to see or hear what was happening. Plus, you are responsible for what the student does during their placement, so until you're happy with their performance, you have to directly observe them. Positive feedback, as mentioned before, is vital. You need to provide solutions to questions, issues, or potential problems that may occur, and also help identify training and education needs of the student. Allow for student input and actively listen to what they are saying. If you do not listen to them, you may miss their learning needs. Listening to your students' learning needs can also allow you to come to a compromise about how they may want to learn something. As mentioned in the first presentation, we're all different learners. You could be a visual learner, your student could be oral. So, listening to what they need may help you come to a common agreement. And the last point is to never use personal remarks. Always concentrate on the act or behaviour. For example, you can't say to a student, "You're too loud." That's a personal comment. Try saying, "Well, X, Y, and Z could have been done in a more professional manner, like," and give them an example of how you would have dealt with the situation. Now that we've established feedback as being one of the most important preceptor behaviours, we'll now go over how to give feedback. I've simplified it down to a 4-step process. After setting clear goals and directly observing the student, you then pull them aside and give them feedback. Firstly, ask the student what they think they did well at. Then you as a preceptor list what they did well at. For example, yes, I agree, you did counsel that patient really well on that medication, plus you gave them some lifestyle advice which I think was great. The third step is to ask the student what they think they could have done better at. Finally, as the preceptor, you then add to the tasks and activities that they thought they could improve. For example, yes, I agree, we may need to go over the side effect profile of that drug, plus I think you may also need to look at improving your knowledge on the interactions. This 4-step approach is easy to remember and execute. Asking the student first about how they did encourages self-reflection. Self-reflection is a vital step to continuing education. If you can't see what you need to improve on, you're unlikely to do further education. Plus, self-reflection is a vital part of their gap year as graduate pharmacists, so encouraging self-reflection now will make it easier for them in the future. The great thing about this process is that it emphasises the positives and avoids the negative feedback. Allowing the student to bring up the area of concern first is great, as it means that you as the preceptor won't have to deliver the bad evaluation of their performance. Occasionally there will be situations where the preceptor and student will have different ideas. However, more often than not, this usually reveals issues in regards to the student's insight. We're hoping with the current degree, such students would have been identified before this time. Obviously, if there is a problem, please don't hesitate to contact the university as soon as you notice an issue. Summarising what's been mentioned so far, try and give feedback in front of peers. Behavioural psychologists say that it's basic humanistic psychology, meaning that humans need to be told how wonderful they are and to be positively regarded by others. We all like to hear, yes, you're wonderful, yes, you're gorgeous, yes, you're right. So, if you're on a ward round and the student brings up an interaction that you didn't see, praise them right then and there and say, good job, or smile, or nod your head to show that you agree with what they are saying and that they are correct. Constructive feedback should only be given in private. Pull the student aside to make a time together to sit down and discuss their work. Ensure that this is in private and not in front of others. Allow for student input. For example, ask them for feedback as to how you are as a preceptor. Are you too hard or too easy? For example, was my assessment of your performance fair? Actively listen as you may uncover some issues with your style of teaching. Again, referring back to learning styles, you won't know what your students' needs are if you don't listen to them. And finally, never ever use personal remarks. So, in closing up, remember, students consider feedback as one of the most important preceptor behaviours. This was well established in the 2004 study by Schultz, where 1,529 medical students, interns and residents were asked to comment on the most important preceptor behaviours, and over 95.6% said it was giving feedback. It was concluded that higher quality feedback is the learning activity that is most strongly associated with the learner's perception of higher quality teaching. So, for us to improve our skills as preceptors, we need to be open to receiving feedback from students so we know what we can improve on, as you don't know what you don't know.